Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about Meniere's disease. At some point in your life, you have likely experienced dizziness. Now, there are a variety of different things that can cause sensations of being dizzy. But one of the worst conditions is called Meniere's disease, because there are several other symptoms that you experience along with the dizziness. That makes it one of the most nasty inner ear conditions that you can experience. According to the U.S. National Library of Medicine's, Meniere's disease affects over 600,000 individuals in the United States, with the additions of 45,000 individuals being diagnosed with Meniere's disease each year. If you have ever had a vertigo, which is an episode of intense dizziness combined with the tinnitus, ear fullness, ear congestions, and fluctuating hearing loss, then you may actually have Meniere's disease. Meniere's disease usually only affects one ear, but it can progress to your other ear in time. And while the sensations of dizziness will eventually go away, you're usually left with the permanent hearing loss. So what causes Meniere's disease? Well, a lot of researchers believe that it's actually a buildup of fluid in the inner ear. And to understand exactly where the buildup is occurring, let's go ahead and take a look at the anatomy of the human ear. First, we have what is called the outer ear, which is the pinna and the ear canal. Then we have the middle ear, which consists of the eardrums, the three bones of hearings, otherwise known as the ossicles, the eustachian tube, and the middle ear space. The inner ear consists of the cochlea, which is responsible for your hearing, and the semicircular canals, which are responsible for balance. Like I mentioned before, Meniere's disease is thought to be related to buildup of fluid in your inner ear, which increases the pressures in the inner ear. It is important to note that the fluid buildup in the inner ear is different from the fluid buildup in your middle ear space, which may be caused by an ear infections. The buildup of fluid in the inner ear causes the disruptions on how the cochlea and vestibular system communicate with your brain, which is why you typically have the symptoms that involve the balance and hearing at the same time. In normal circumstances, your brain expects to receive similar informations from both of your ears. It is this mismatch of signals between your affected ear and your non-affected ear that causes you to feel dizzy. That being said, even though the excess fluid buildup in the inner ear may be causing Meniere's disease, researchers don't know 100% for sure is the only cause. Some believe that it can be linked to blood vessels, constrictions, viral infections, allergies, autoimmune conditions, or even genetic factors. Episodes of Meniere's disease may be triggered by being tired, emotional distress, dietary factors like too much caffeine, or too much sodium, or even just stress in general. Meniere's attack can occur at randoms, sometimes with several episodes in a very short periods of time with each other. Then in other cases, that can be months between attack. Meniere's disease is often diagnosed by an ear, nose, and throat physician. It can occur in any age, but in most cases, it affects individuals between the ages of 40 and 50 years old. Since there is no gold standard test to diagnose Meniere's disease, physicians typically look your medical history to identify symptoms such as 2 or more episodes of vertigo lasting in 20 minutes apiece, an onset of roaring tinnitus, hearing loss in the frequency range, which gives the receptions of volume loss, and feeling of ear fullness. Your physician will likely order some additional testings as well to support the diagnosis, which may include a hearing test, vestibular or balance testing, and even an MRI or CT scan to rule out possible medical conditions. When it comes to treating the disease symptoms that are associated with Meniere's disease, individuals typically rely on the medications, dietary changes, and vestibular therapy. Then you don't need me to tell you that Meniere's disease is no joke. So if you're experiencing dizziness along with tinnitus, ear fullness, and hearing loss, then you got to hold on to your physicians right away so you can start treatment as soon as possible.